Your knee does not need to scream before something is wrong. Sometimes, the first warning is a tiny hesitation before climbing a stair. A stiffness that disappears after breakfast. A swelling you blame on yesterday's walk. Then, one day, the knee locks, buckles, or refuses to carry you normally. The frightening question is not simply, why does my knee hurt? It is this. What has been changing while you kept ignoring it? Most people imagine knee deterioration as sandpaper slowly grinding away a cushion. But that picture is incomplete. Your knee is not one disposable pad between two bones. It is an entire living system made of cartilage, bone, fluid, ligaments, muscles, tendons, and an active joint lining. When one part struggles, the others change how they carry the load. That compensation can quietly create a destructive loop. And, because many of these signals are easy to dismiss, subscribe before we enter the joint itself. On this channel, we expose the hidden mechanisms inside ordinary symptoms, so a small warning never remains invisible simply because nobody explained it clearly. But first, an important warning. Knee pain does not automatically mean your joint is rapidly breaking down. A tendon, muscle, bursa, meniscus, ligament, inflammatory condition, or recent injury can create similar symptoms. Only a qualified medical professional can determine the real cause. However, certain patterns deserve attention because delaying assessment can mean delaying treatment that may help protect your movement and function. Here is the illusion almost everyone believes. If you can still walk, the knee cannot be seriously affected. But the human body is an expert negotiator. When a joint becomes painful, your nervous system changes your movement automatically. You shorten one step. You rotate your foot. You lean toward the stronger side. You push harder through the opposite leg. You may remain mobile, but the movement strategy has changed. Think of it like driving a car with one soft tire. The car still moves, so the problem feels harmless. But every kilometer redistributes force through the suspension and the remaining tires. Your body does the same thing. The knee, hip, ankle, and surrounding muscles begin negotiating with one another. The pain may fade temporarily, not because the cause disappeared, but because the load moved somewhere else. The first signal is recurring pain during loaded movement. Perhaps it appears while climbing stairs, standing from a low chair, squatting, or walking farther than usual. One painful day does not prove that your joint is deteriorating. But a pattern that returns, becomes easier to trigger, or changes how you move deserves attention. Osteoarthritis commonly causes pain during joint use, although many other knee problems can do the same. Which movement bothers your knee more? Stairs or standing from a chair? Type 1 for stairs or 2 for the chair. That single number may help you notice a pattern you have been overlooking. The second signal is stiffness after rest. You wake up, begin walking, and the knee feels temporarily rusty. Or you stand after sitting through a movie and need several careful steps before moving normally. Imagine a door hinge that resists its first movement, then slowly loosens. In osteoarthritis, stiffness after inactivity is common. Morning stiffness is often relatively brief. But stiffness that lasts much longer, especially when combined with warmth or swelling in several joints, may point toward an inflammatory condition and should be discussed with a clinician. The third signal is swelling that repeatedly returns. Your knee contains a thin lining called the synovium. It helps produce fluid that reduces friction inside the joint. Think of it like a maintenance system releasing lubricant into a moving machine. When tissues inside the knee become irritated, that lining can become more active. Extra fluid may begin to accumulate. The knee can look puffy. It may feel tight. You may lose some ability to bend it. Swelling after unusually heavy activity may settle. But repeated or unexplained swelling should not become your new normal. And what about clicking or cracking? Noise alone is a poor detective. Many healthy knees click without pain. A painless sound does not automatically mean cartilage is being destroyed. But clicking combined with pain, swelling, locking, or the feeling that the knee may give way is different. The sound is no longer the whole story. It becomes one piece of a larger pattern. The fourth signal is a shrinking range of motion. Maybe you cannot bend the knee as deeply as before. Perhaps it no longer straightens completely. You change how you enter a car. You avoid kneeling. You swing the leg outward when climbing stairs. This loss of movement can happen when pain inhibits motion, swelling takes up space, muscles tighten, or structures inside the joint begin to change. The crucial point is that reduced movement can become self-reinforcing. You move less. The muscles supporting the knee begin to weaken. With weaker support, ordinary tasks feel even harder. The fifth signal is instability. This is the feeling that the knee is loose, unreliable, or about to buckle. Sometimes pain briefly reduces confident muscle activation. Sometimes weakness, ligament injury, meniscal problems, or arthritis may contribute. Picture the muscles around your thigh as active suspension cables holding a bridge steady. When those cables cannot react with the correct force and timing, the bridge may remain standing, but every crossing becomes less controlled. Does your knee feel dependable when you step off a curb? Type yes or no. Do not test it deliberately. Just answer based on the movements you already make in normal life. The sixth warning is not a specific sensation. It is a change in your life. Your usual walking route becomes shorter. You begin choosing seats based on how difficult they are to stand from. You avoid stairs. You skip errands. You stop doing activities you once enjoyed. These adaptations happen gradually, which makes them easy to miss. But function is evidence. When the boundaries of your day keep narrowing, the knee is affecting more than one joint. Now we reach the part most people never see. How can a small symptom become a system-wide feedback loop? Subscribe here, because we are leaving the surface and entering the machinery. And the mechanism is far more complex than two bones simply wearing out. At the center of the knee are three bones: the thigh bone, the shin bone, and the kneecap. Their contacting surfaces are covered by articular cartilage. This is a smooth, resilient tissue designed to help the surfaces glide while distributing force. Between the thigh bone and shin bone sit two crescent-shaped structures called the menisci. They help spread load across the joint. Ligaments guide stability. Muscles control movement dynamically. Fluid reduces friction and helps nourish tissues. None of these components works alone. Cartilage behaves less like a simple rubber pad and more like a water-rich engineered sponge reinforced with microscopic scaffolding. Under load, it deforms and spreads pressure. When the load decreases, it recovers. But cartilage has a limited ability to repair major damage because it does not have the rich blood supply found in many other tissues. That does not mean every ache represents irreversible cartilage loss. It means the joint depends on a delicate balance between mechanical stress, tissue maintenance, movement, and recovery. Osteoarthritis is now understood as a disease of the whole joint. It is not simply thinning cartilage. The bone beneath the cartilage can remodel. The joint lining can become irritated. Meniscal tissue may change. Muscles may weaken. Small bony growths can form around the edges of the joint. Imagine a city whose roads, foundations, traffic control systems, and maintenance crews are all responding to the same growing pressure. A change in one district shifts stress into another. And here is the twist inside the mechanism. Cartilage itself does not contain nerves. Pain often comes from other structures: the bone beneath the cartilage, the joint lining, ligaments, tendons, muscles, and the nervous system's interpretation of all those signals. That is why pain intensity and visible joint changes do not always match. One person may show significant changes on an X-ray, but experience only mild symptoms. Another may feel severe pain even when imaging shows fewer structural changes. The pain is still real. But pain is not a direct cartilage meter. Now watch the feedback loop begin. Pain changes movement. Changed movement alters where force travels. Fear of pain can reduce activity. Reduced activity may weaken the thigh and hip muscles that help absorb and control force. With less muscular control, the knee can feel less stable. Instability reduces confidence. Reduced confidence leads to even less movement. This cycle does not guarantee rapid structural destruction, but it can accelerate the loss of strength, mobility, confidence, and independence. That is why ignoring symptoms matters. The danger is not that missing one appointment causes cartilage to disappear overnight. The danger is that a treatable injury, inflammatory condition, or movement problem remains unidentified while compensation becomes a habit. Early assessment may reveal that the answer is not surgery. Depending on the cause, management may include education, carefully progressed exercise, physical therapy, adjustments in activity, medication, or other clinician-directed treatments. Another common illusion says that a painful knee should never be loaded. Complete rest may feel protective, but prolonged inactivity can weaken the system supporting the joint. For many people with osteoarthritis, appropriately selected exercise can reduce pain and stiffness while improving strength and function. The key word is appropriate. Exercise should match the diagnosis, symptoms, and abilities of the person. Sudden severe pain or a major injury is not a signal to push through blindly. Progression also differs from person to person. Age may matter. Genetics may matter. Previous joint injuries may matter. Repeated occupational or sporting stress may matter. Muscle capacity, joint alignment, and metabolic factors may also play a role. Body weight can increase mechanical load at the knee, but it should never be used to shame someone or reduce a complicated condition to one cause. Two people with similar symptoms can have very different joints, histories, and treatment needs. A proper assessment begins with a story, not a scan. When did the symptoms begin? Was there an injury? Where exactly is the pain? What triggers it? Does the knee swell? Does it lock? Does it give way? A clinician may examine the way you walk, the alignment of the leg, areas of tenderness, joint stability, muscle strength, and range of motion. Imaging or laboratory tests may be used when appropriate, but an image must always be interpreted alongside symptoms and physical findings. Pay special attention to the word locking. People sometimes use it to describe stiffness or hesitation. True locking means the knee becomes mechanically stuck and cannot move through its normal range. That can indicate a structural problem requiring prompt assessment. Repeated giving way also deserves attention, especially if it causes falls. It is not something you should simply normalize or repeatedly try to walk off. Some symptoms should bypass the wait-and-see approach. Seek urgent medical care when a knee is extremely painful, badly swollen, or visibly deformed. Seek help when you cannot move it or bear weight. Seek help when the knee truly locks. And seek urgent care when the joint becomes hot and red while you also have a fever or feel seriously unwell. A hot, swollen joint combined with systemic illness may signal an infection. That requires urgent evaluation. Major trauma or rapidly worsening symptoms also deserve prompt medical attention. Do not assume every swollen knee is osteoarthritis. Do not assume every cracking sound means damage. Do not assume pain is merely part of getting older. And do not assume a young person cannot have a meaningful knee condition. Symptoms can come from injuries, inflammatory diseases, infections, and many other causes. The purpose of warning signs is not to frighten you into diagnosing yourself. It is to tell you when uncertainty deserves professional attention. How long have you been noticing your main knee symptom? Type just one word. Days, weeks, or months. Seeing the duration written down can make a vague problem suddenly measurable. Before an appointment, record a few useful details. Note what you were doing when the symptoms began. Write down where the discomfort appears. Notice whether swelling occurs. Record how long stiffness lasts. Include any injury. And note whether the knee locks or gives way. This is not about obsessively scoring every sensation. It is about replacing the phrase, "it hurts sometimes," with a pattern a clinician can actually investigate. Now imagine the feedback loop continuing unchecked. The painful knee receives less confident movement. The supporting muscles lose capacity. The person avoids stairs. Then longer walks. Then social activities that require walking. Balance may decline. The opposite leg and the hips begin doing more work. Sleep may be disrupted by discomfort. Lower activity can begin affecting overall health. The original knee problem has now expanded into a whole body and whole life problem. It resembles a city closing one lane on a critical bridge. At first, traffic reroutes. Then neighboring roads become crowded. Drivers change their schedules. Businesses receive fewer visitors. The bridge did not swallow the city. The network adapted around the bridge until the consequences spread. A neglected knee can affect the body in a similar way. Not because breakdown is always rapid, but because compensation can multiply the functional cost. But this story is not destiny. Osteoarthritis usually develops over time. Symptoms may improve and worsen in cycles. Many knee problems can be managed without surgery. Timely evaluation, progressive strengthening, suitable physical activity, and an individualized treatment plan can help preserve function. Even when structural changes cannot simply be erased, the system surrounding the joint can often become stronger, more capable, and less sensitive. Subscribe if this changed the way you interpret pain. The goal is not to make you afraid of your body. It is to make its signals understandable. Because information can turn a mysterious warning into a practical conversation with the right professional. And here is the deeper truth. Your knee is not a machine part wearing toward an expiration date. It is a living negotiation between tissue, muscle, the nervous system, movement, behavior, and the environment. Pain is not merely an alarm coming from one damaged location. It is the body's protective calculation. Sometimes that calculation is precise. Sometimes it becomes overprotective, but it is always influenced by context. The future of the joint is shaped not only by what appears on a scan, but by how the entire system responds. That means the earliest meaningful sign may not be swelling or a dramatic cracking sound. It may be the moment you stop trusting a movement, the stare you begin avoiding, the shorter route you quietly accept. The body often whispers through behavior before it shouts through disability. Paying attention is not weakness. It is maintenance for the system that carries your entire life. So the next time your knee repeatedly stiffens, swells, buckles, locks, or changes how you move, do not diagnose it from a sound. And do not dismiss it as just age. Observe the pattern. Get appropriate medical advice. And then ask the question waiting in the next video. If movement protects the joints, why can the wrong movement make pain feel even worse?